Started. My name is Professor Laura Rosella. I am the education lead at the Center for AI Research, Education, and Medicine, otherwise known as T-CAIREM, welcoming everyone to our Temerity Center speaker series. Today we have Dr. Jude Kong. Before I introduce Dr. Kong, I'd like to just say a few words. First, starting with a land acknowledgement. We wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. T-CAIREM is at the University of Toronto, has been made possible by the generous donation from the Temerity family. T-CAIREM is an interdepartmental center that serves as a focal point for collaboration among healthcare providers, trainees, researchers, computer scientists, engineers, and industry. And our goal is to transform health through AI. If this is your first speaker series and interaction with T-CAIREM, welcome. We hope you look into our website and consider being a member. And if you're coming back, we thank you for continuing to engage with us. Also, just a quick mention, this event is CPD accredited. To obtain your CPD credit, please use the QR code that we will show on screen at the end after the presentations. So just a note on Q&A. So there's a Q&A function in Zoom in our webinar that you can use to submit questions for today's speaker. We will get to those questions towards the discussion portion, so you can put them in at any time and we'll address them then. And also noting that by attending, you are consenting to being photographed or recorded for non-commercial use by T-CAIREM. So without further ado, I'm very happy to introduce our speaker for today, Dr. Jude Kong. Dr. Kong is a Canada Research Chair in Community-Oriented Artificial Intelligence and Mathematical Modeling of Infectious Diseases. He is a professor in the Decoloniz School of Public Health here at the University of Toronto and cross-appointed to the Mathematics Department and the Institute for Health Policy Management and Evaluation. He serves as the director of the Artificial Intelligence and Mathematical Modeling Lab, or AIM Lab. And there are so many great accomplishments I could mention, but I do want to specifically call out during the COVID-19 pandemic, Dr. Kong led a team of more than 50 researchers across 9 African countries using AI to help contain and manage the virus. Really impressively, he founded this growing network that's hugely popular, AI4PEP network, and that's overseeing more than 160 researchers from 16 countries. And the network is focused on leveraging Southern-led responsible AI solutions to enhance public health systems for better prevention, preparedness, and responses to disease outbreaks. So just an innovator in community-oriented artificial intelligence, a builder, as you can see by everything I just said, and we're absolutely thrilled to have Dr. Kong with us today. So over to you, and just pull up your slides whenever you're ready, Jude.
Thank you so much for the amazing network.
Oh, I can't hear you. Oh, wait.
Can you hear me very well now?
Might be me.
Can you hear me clearly?
Yes, we can, Dr. Kong.
Okay, you can hear me. Okay, good.
Yes, we can hear you well, and we'll just need your slides in slideshow mode.
Obviously, thank you so much. I was going to thank you so much for the introduction, and then you could not hear me. I want you to hear this because I didn't want you to miss this. I know others could hear, but I didn't want you to miss this. I will say that we have been able, within a short while at MLab, to achieve a lot and to get to where we are, but we could not get there without you. A lot of people that know me may know me, but they don't know the role you play behind the scene. So I want to thank you for the role you have played behind the scene to get up to where we are. I am grateful. The team at MLab is really grateful. We talk about you all the time. So thank you so much. Today I will be talking about a network that we have built that I'm really passionate about. That's doing amazing work. And I specifically model a title so that it speaks to it. AI4PEP, which is a network but I call this a model for decolonizing AI in global health for pandemic preparedness and response. Mark notes of the word model. And as I will go on, I will be saying how this is a leading team, and that's why presenting the approach that we use, the model, is very, very vital. Before I start, I want to just present to you how I will build this conversation. I will start with just introducing you to AI4PEP, which is the Global South Artificial Intelligence for Pandemic and Epidemic Preparedness and Response Network. Then I will just give just a short description of our approach, what makes it a decolonial, and why is it unique. How we become the leading AI and health network in the Global South within a short period of time. And that will be based on the approach. And then some of the solutions that we have designed within this short time and what to expect from us. Again, we have done a study that was commissioned by the International Development Research Center of Canada to actually look at what to expect in the Global South in Digital One Health. And so again, this is geared towards what we plan to come up with in the 5 to 15 years. So what you expect from the Global South, and some conclusions where I'll be presenting the things that we'll be doing in the short terms. I would like to acknowledge NSEC, the Canadian Black Scientists Network, the International Development Research Center of Canada, New Frontiers in Research Fund, the UK Development, International Development under FCDO, and CDAM for funding the work that I've been doing, as well as our school. To start with, those of you that know me very well, I always start my talk by indicating where I was born and my background. And this is because my work is very personal. In addition to this, the people that are in this network share same background or come from similar communities and are passionate about the same issues. So though I'm presenting my background, it speaks to everyone within the AI4PEP network. So I was born in a very tiny community in Cameroon. This is just my locality here. You will not see any electric pole moving around, so no electricity, no pipe-borne water we drink from the stream. We cultivate our crops here, and this is just like any other person within AI4PEP network or people that are allied to such communities. The key that led to the work that we do is the distance from these communities to the healthcare system or the hospital, as you may put it. So growing up in this community was a tiny community under the Jackie subdivision, far away from the divisional capital, which had one family doctor who stepped to work there. And this family doctor had to attend to hundreds of villages around. Most of the time, when I was growing up, the salary could not come to them directly. They would travel for like a week to go and collect their salary. So when people were sick, unless they're at point of dying, it would take around 4 hours to walk to the subdivisional hospital. And before you get there, the family doctor, just one of them may not be available. And you are asked to move to Kumbu, which is the next bigger city near Jakiri. And I was far away in a very remote area. And on the way, most people would die because the route was really horrible to get to the hospital. Kumbu had a lot of hospitals, the Shison Catholic Hospital, the Baptist Hospital. But before you get there, it was very difficult. And within that, most people in the village tend to self-medicate. Most people, you had a single mom like myself raising 5 kids. You have no job. You have to work in the farm. So you don't have time to go to a hospital, waste time, and you don't even see the doctor. So most people tend to just self-medicate with local herbs and all whatnot. And myself, I think the first time I ever saw a doctor was in Italy. It took a while for someone to go to a hospital unless someone is dying. And so when I graduated from the undergrad, a lot of things happened for me to get from that community to undergrad, because it's always very difficult, as we always just live in our community, self-contained within a community. What struck me was when I learned that the mathematics I had studied and computer science could be used, because I had major in mathematics and minor in computer science, and I didn't know what I was going to do. I was going to go back and look for a community school and teaching. Then I learned that mathematics could be used to fight malaria, and I thought of my aunts that died in my back, and I was so passionate. Fast forwarding through that, I did my master's and my PhD and get to where I am today. And when I started forming this network, the AI4PEP, we were thinking of how do we create proactive tools for a community like mine. And we started with 15 countries at that time, and I'm glad to say we have expanded to 21 countries thanks to donors that see the importance of this work that we're doing and come in and said, we want to fund this. We started with 10 countries initially, only in Africa. We expanded to 15 countries. Now we are in 21 countries, top universities working in such communities. I identify people in those communities. It took a long time to build those relationships, to identify people in those communities that live in the type of community I grew up in, that understand the dynamics in such communities and are passionate about it. To us, it's not about a job, it's about passion, where you can work and you tend to say, oh my God, I want to spend the day. Why is the time so short? Rather than I need to end today. Oh, when am I supposed to end? You want the time to continue because you care about your community. You want to be able, there was a major issue in your community with you growing up and you don't want other people to experience the same. And so we build this across the entire global South. And the foundation of what everyone in our network, working with government and communities, civil society organizations that spent years within these communities care so much about is health and well-being for all. And this is why you see this line down here. It's just like the foundation. What laid the foundation to who we are, health and well-being for all, and gender equality. Under this if you look on top of this foundation, there are 3 pillars. It's very important to start by inclusion and equity for vulnerable groups, the type of communities that we care so much about. To us, it's about the community. Everybody in our network talk about communities. That's the first thing that come in, and communities sitting on the table with us and the government. Through that, we're able to strengthen the healthcare system, working with government and community, and ensure that we make data actionable, provide timely data to government to address these thematic areas: earlier detection, earlier warning system, earlier response, and then mitigation and control or eradication of existing diseases, while acknowledging that human health is not dissociated from animal and environmental health, and using artificial intelligence as a catalyst. I want to stress on the word catalyst. That's not the end result. The end starting point is the problem that is in our communities to solve it. In as much as you can make data actionable in any multiple ways, we do that while using artificial intelligence as a catalyst. I don't know how many people have seen Subservience, but it's it's one of the movies that I love so much. Again, I couldn't see who have seen Subservience, but I will acknowledge a lot of us have seen Subservience here. But what actually touched me was about Megan Fox, who was an AI solution, and Nick, whose wife was sick in the hospital, and Nick had 2 kids with a wife and was looking for an AI solution that could support him at home. And when he brought Megan Fox, the AI tool solution, Megan Fox was trained to serve the master. And when I'm talking about this movie, think of a health system, think of the AI being very intelligent, billions of intelligence, and think of the emotional component, the heart that's being removed from that. Megan was trained to serve the master, Nick, in all dimensions, but the emotional part was lacking. Intelligently, she was doing everything. At one point, Megan take the kid to school, clean the house, cook, did everything. Everything anybody could think of at home. But that emotional piece and the desire to only respond to anything that would make the owner happy became an issue because the emotional piece could not come in. This is something I quote on my screen here, which says, if it makes your life simpler, I don't mind at all. So anything that simplifies life, without taking into account the emotional part of it, just to simplify life for the master. At some point, Megan was about to kill Nick's children and the wife, just to make life easier for Nick because Nick was not happy. Another movie that actually touched me was Atlas with Jennifer Lopez, where the mom had created Harlan, an AI solution that ended up killing the mom. And Helen became a terrorist and left the earth thinking that humanity was against their own interest and had to eradicate them for their own good. Though Atlas was skeptical about AI, it was another AI solution, Smith, that ended up helping Atlas in her mission to get rid of Helen. And through that, she succeeded. When you look at these two movies, the point I'm trying to make is, how do we, yes, we need the AI. Yes, AI will become a common good if we see how Smith was able to help Helen. Yes, Nick relied on Megan Fox, which is the AI, to solve everything, which is exactly where we're going to in the world. But how do we ensure that we create Smith and not the terrorist Helen? And that's why I'm driving with all of these, if you watch these two movies. So to us, the first thing we did was to create a framework. Again, I encourage everyone to always create a framework where we ensure that any AI solution that we were building was locally relevant and informed by the communities. Again, by local relevance, I mean autonomous, caring, connecting, decolonize, human and community-centered, inclusive, intentional, intersectional, just, practical, protecting, process-based, and sustainable. That it was responsible and ethical for policies and regulation. By responsible, accountable, auditable, compliant, ethical, respectful, safe, and secure. Again, as you listen to this, I want you to judge back to the two movies I've just explained and see how we can build AI solutions that serve us, but then avoid that. Explainable to the whole society at large. By explainable, I mean equitable, interpretable, fair, reliable, reproducible, transparent, trustworthy, and unbiased. It's only when we realize that we're able to do this together with the communities that we move on to collect data, design a model, deploy it, observe the performance, and continually monitor it again and adjust it in real time to a point where we feel that it's acceptable and serving the needs of the communities in a way that the community feel that this represented is part of them. And it's very, very important that we look at the intelligence piece, which will exist. We'll have billions of intelligence. I remember a friend of mine giving a talk the other day about billions of intelligence, and it's already exists. And the emotional piece, it's very important that we do this, especially when it comes to medicine and public health. And we pay a lot of attention to this at AI4PEP. One of the projects, I'm going to present a few case studies now that you know the way we work, our strategy, and what got us here. One of the solutions that we're proud of is our polio antenna. Again, we're proud of all our solutions. I'll present some case studies. For the sake of time, I will direct you to our website for other case studies, the solutions that are changing lives in communities used by the government. When I present a few here, that is by no means are the best solutions that we have. All our solutions are amazing in all the countries that we're working in, 21 countries that we're working in. But I would just, for the sake of time, just showcase a few of them. One of those is the polio antenna solution in Ethiopia. And I must thank the Canadian government for the role the Canadian government have played in the eradication of polio around the world. And I would like to add that polio is coming back in a lot of places because of type of communities like the one I grew up in. And the problem with polio surveillance, no matter the investment that we have done, and again, thanks to our government and WHO and others that have surveilling this, and the Gates Foundation as well, the difference is when you look at these children here with their paralysis, it's very difficult to say that this paralysis is as a result of polio, acute flaccid paralysis, or this is just normal paralysis. And that's a problem. And so parents tend not to distinguish. Kids play all the time, and kids never complain. So parents tend not to know when their kids have acute flaccid paralysis till things are out of hand, because they could feel that the kid was just playing soccer and then end up with an injury. It's as a result of playing outside, and then things get out of hand. Ethiopia is not different from that. What we did was to team up with civil society organization in Ethiopia. One of those is the core group that work in communities across here, the Oromia region. All of these red dotted area is where the core group have been working before we started getting into this project. We brought the core group and the government of Ethiopia on the table, And when we brought the government to the table, the data that was recorded was in terms of either images like these. These are different images we collected from the civil society organization, or in paper form. Again, initial thing we did was to ensure that once we gave it to the government, you need to give it to the government within the context where we work, where we said, this is a government project. We will help the government to ensure that we digitize all this data. We put it into a system and created a database for polio within Ethiopia and gave it to the government. It became the government property. Again, the government did it. We assisted the government in doing that. From there, once we had the data, the next thing was, how do we improve on the surveillance? Ensure that parents are able earlier on to distinguish between normal paralysis and acute flaccid paralysis. And what we did at that point was we took all the data set, the images, the audio, and the video data that we had. We trained an artificial intelligence model. I will talk about the model that we trained just in a little bit. But when we took this test, this data, we did data fusion, combined these different data sets, text, image, and video data. And we trained a model and convert this into an app. And what happened within local communities is, if you're in a small community, far away from the central system, it's not that there are no healthcare workers, but there are remote areas that it's difficult for you to reach. If you realize that your kid is behaving weird or anything's happening, the mom, if you don't have a phone, ask for your neighbor's phone. You take a screenshot of that. The moment you put in that screenshot within the system that we have created, and this is advertised through churches, through community organization, that signal in the central system in our partnership with the government, and your geolocation is indicated, our model will be able to indicate that there is either a 70% chance, an 80% chance that this could be polio. Then a community health worker is commissioned to visit you immediately. Once that community health worker visits you, within the system now, it's no longer in paper form. Within our digitized system, they're able to take information, your personal information. They take your stool, and then the QR code that was generated once you did that is equally used here to map it to that, and then that's sent to the national lab. With this have actually improved the sensitivity, and we're detecting cases very early on. So the model is in such a way that visual transformer model, which is such a way that you take the images. Well, once the images are coming, you divide the images into patches in the AI model before the fusion that we do a fusion, combining it with the text model and audio model. And then you convert that into a vector, a tensor, by flattening the different patches of the image. Once you do that, then you encode that, and then you transform that, and then you train a model to be able to distinguish whether it's normal paralysis or acute flaccid paralysis. And this is working effectively well, performing really well so far with high sensitivity. The app currently right now is being used by the government. If you see here, this community worker in different languages, you have English, Oromia language, and Amharic, and the other languages. You collect the information within the area, the information is served there. Within the national lab, they have that there. And you don't need to leave your home because your geolocation, once you take that image, is sent to the government directly. And the government is able to come to your location and be able to solve it, to be able to take these samples and everything, and then somebody is there to help you out. Another project that I want to pinpoint, there's detail about this project, which you can find on our website, the Earlier Polio Project, a lot that has been done. And I'm really impressed that within a short period of time, the government have adopted it and is already scaling it up. I'll talk about this later on. Another project that we're passionate about is when we finished COVID-19 in South Africa and around the world, the major thing was on the air quality. And this is not just outdoor air quality, but indoor air quality because of the respiratory diseases that are emerging as a result of the quality of the air. I'm just going to present to you here the city of Johannesburg, a very beautiful city. But it's not always, the sky is not always this way every day or all the time. Just not far from Johannesburg, just in the neighborhood, you have the Kiosan, where people leave Johannesburg with their trash every night and burn it here. again, we have been working with the communities organization within Kiosand. If you look at this code, you look at some of the things we have posted with the community organization on how to get the government to be accountable for the trash that's being dumped in Kiosand, burning there. And even though people leave Johannesburg, the quality of the air come back to Johannesburg because this is a community within Johannesburg. It's a beautiful city. And not far from there, you have the Kanana gold mining, and this scattered all over South Africa, where you have all of this smoke within the community, and nobody cares about the quality of the air or the health of the people. No study has ever been done about the health of the people in these communities surrounded by this smoke or the Kiosand. Again, I'm really proud of the civil society organization in Kiosand that have taken the lead to take the government to court and fight this. But nobody has ever done this, and our tool is being used to be able to indicate to the government, and they can now make a case. Another major issue is on that of women that cooked on the 3-stone fire site. Spend all the evening, I grew up all my time in the evening telling stories in the kitchen every night. Didn't have electricity to watch TV or play games. And again, my mom still cooked on 3-stone fire site with no electricity in the village. So that the health outcome of this has never been measured. And when we started this project with South Africa, it was about outdoor, and I was able to get our colleagues to think of indoor, thinking about my community and the smoke in the kitchen. And I must say that we're able now to have a tool that both outdoor and correlate that with the health outcome and indoor. At the same time, we're able to send messages to warn people if the air quality is going to get beyond a certain level, or within the kitchen, if it is at a level that nobody should be in that particular kitchen or house. So we're able to warn them ahead of time. Our tool is a system that we have built, and it's embedded, sending text messages from time to time based on the level of the air quality. And we call the system the AIR system. I call it the Canada Africa solution because it was built by the team within here and South Africa. We measure different components, including carbon monoxide, carbon dioxide, and the various particle matter within the environment. And this is immediately, the solution that we built here is immediately made available on a dashboard. Within the dashboard, we have a graphical neural network there. We get a recurrent unit that's able to, that has been trained using the data on the air quality, and then it's able to forecast the air, be it the carbon monoxide level, be it indoor and outdoor. And if it's going to cross a certain level, messages are sent to the entire city about the quality of the air to ask people to stay indoor. And if you are using a kitchen 3-stone fire site, it's able to tell you, well, this kitchen is not in a way that somebody should be in at this point. This has been adopted in South Africa by the Ministry of Environment, Forestry and Fisheries. We are currently at the point of scaling this up to other countries in Africa. We are having conversation with Ethiopia and Cameroon at the moment to scale this up. But this is effectively being used in South Africa. We believe this would reduce the respiratory disease within the country. Another solution that I would like to present to you is on tracking the different mosquitoes that are appearing. If you were listening to the news, you must have heard of the Anopheles stefansi, which is a type of mosquito that is usually in Southeast Asia. But recently, it's been invading the eastern part of Africa and West Africa, for that matter. It was in Somalia, in Ghana last year. And with our team in KNUST, what we have done over the years is that we have collected different mosquitoes in Ghana from these different communities, recorded the sound bits within the lab, and then train an AI model with the different sound bit of the different mosquitoes in the lab at KNUST, where the students are working on this and then measuring, well, the type of pathogens within the mosquito. Then build a sensor where with microphone attached that's listening to the sound and determine what type of mosquito that may be and the pathogens in the mosquito. And then we have placed this in communities across Ghana. At the moment, we are currently in Ghana on this, but there are conversations to transfer this to the Philippines as well as Indonesia and Cameroon as well. So we're just having those conversations, but this is currently being implemented in Ghana. With this, we place these sensors in communities across, this is connected to a dashboard with AI models that modeled gated neural network at the same time that's able to forecast, to be able to say the type of mosquitoes within a community. But the most important thing here is the classification. When a new mosquito comes in and is not recognized within the ones that we have classified, the dashboard will signal that that's not detected. And then because there's a trap on the device that we place, we'll go and collect the mosquito. Our team at KNUST will collect the mosquito and come and study that. If it is a new mosquito, then we're able to report it to the public health services and they take it from there. Our team played a big role with the Anopheles stephanus, and that's how we have continued to work with the government. With all this outbreak, one of the major issues within the Global South, and again here in our community, is misinformation and disinformation. In Brazil, it was a major issue immediately after the COVID-19, and we've continued to work on that. We all here can confidently say that we have been misinformed or see any information online and believe that this is true. Meanwhile, it turned out that, oh, that's not really true. You could reflect about this. Again, I asked a question, how confident are you in your information sources? The information you see every day. How confident are you? I must say I'm not confident at all. I don't know about you most of the time, but I always have to verify and use my intuition to think. But what we did was to build a tool called Dominic. It's a chatbot. We wrote a paper on that called, Is That True? Where we're trying to detect fake news. With Dominic, if currently right now, Dominic is currently present on WhatsApp, and we're currently using Dominic. With the way Dominic was built was this: there was a paper published by William Yang Wang on Liar Liar Pants on Fire, which is where he collected all the tweets, posts that have been declared fake news again. You could read the paper to see. I'm not in a position to ever judge anything as fake because it's relative. I would never tell anybody this is fake news because I believe it's relative. But he collected all of that. And there's another paper on the Portuguese corpus, which was published, gathering all the fake news posts that have been posted. So we use these two papers to be, this has more than 8,000 posts on, I think it's around 12,000 something posts that we used to be able to train the model to detect whether a post is fake or not. This will be based on these two papers. Wherever our tool, if our tool is working very well, it will be best, then these papers are accurate. I trust these papers, but I would not say 100% that these are the ideal paper, but this is towards ensuring that we're able to build some of these and detect fake news. With Dominic, right now that we have, if you get any post and you were on Telegram, again, we're on Telegram and WhatsApp, because Telegram is mostly used in some of the communities where we are. You launch Dominic will tell you, welcome to Is That True services. My name is Dominic, and I will help you identify misinformation. Before you start, you put in the information on Dominic. Dominic will tell you this information, to my knowledge, this information is, say, 88% likely to be fake based on the data set that I was trained with. We do make sure that Dominic is explainable so that you know that Dominic may not be the best, but Dominic is basing this on all the tweets, all the Facebook messages and WhatsApp messages have been identified to be fake as published by those articles that we use. We use 2 articles to build Dominic. And again, we continue to improve Dominic going forward, but this was just a starting point. But I must say at this point that any fake news that have turned out to be fake, Dominic always identify it with more than 90% accuracy that is fake. Another tool that we have been able to build is on an earlier warning system for all diseases that the countries that we work in are concerned. Some are respiratory diseases, foodborne diseases, vector-borne diseases. I will present here just one of those earlier warning systems. I call it earlier warning system because the government is using it. Otherwise, still a prediction and forecast tool. I wouldn't want to call it an early warning system till the government start using it. But most of the government in some of the communities are already using some of our tools. And that's why I can confidently call them an early warning system. The reason why we thought about this is the traditional surveillance system. And again, this is stemming to our work back during COVID-19, where the traditional surveillance systems are often have a lot of limitation, cost, the time, and logistic challenges. For instance, think of avian influenza. To survey avian influenza, you need to collect the dead birds, both domestic and around. Then once you collect it, you collect clinical data, you survey this, you take this to the lab, you test it, and then you get the data. And this always takes time. So this cannot be used as an earlier warning before you realize all of these experiment testing in the lab, there's already an outbreak. Our approach is to use what our colleague at the Wellcome Trust have termed social data. We typically call it unconventional data, but after some engagement with our colleague at Wellcome Trust, I agree with that definition of social data, where it's data generated through engagement with digital systems, devices, and sensors. We have a lot of these type of data, which is freely available. And one of those is web-based data, where we have RESTful APIs that you can be able to tap into unconventional data, very fast to get into, cost efficient. You don't need to pay anything. Well, you may have to pay some AI models to be able to get their data as we currently used. You can access them automatically and provide data in days or weeks earlier, rather than the approach that we used in surveillance, when it would take months. And before you realize these people are, the disease is already there. You cannot use that as an earlier warning system. For within 1 month, you already have it invading communities. Such unconventional data include number of searches, the news reported in local communities, Facebook, Reddit, AI models. Currently, right now, people are searching things on AI, and we have started using AI models. So what we do is to get all those data, clean the data, pre-process the data, then train the model, then validate the model, and then continuously feed the data in so that we continue to train the model and improve on the performance. Some of the data we are currently using is historical data from cases. We use Google Trends. We use GDELT. I'll be able to show that, which is just news articles in different languages around the world. That signal. We use Google News, Reddit, Facebook, Wiki Trends, weather and air quality and temperature data. And all these are collected through RESTful API or web scraping without human intervention. And we currently, if you check MSLab website, we have automated this in most of the cases. You may find the MLab website or AI4PEP with other diseases. With the MLab website, you may find most of the respiratory diseases, but around the world, you find other diseases that we have looked at. And we have automated this in real time. And as you will see in this result, we're able to forecast 58 days in advance for any re-emerging diseases. We are moving towards ones that are emerging. At this point, we can be able to forecast a re-emerging disease 58 days ahead of time, not an emerging one. If you think of this, one of those is Google Trends. With Google Trends is when people have issues, they'll go online and search. Once they search, you'll be able to get, if people are experiencing flu, sore throat or so, you get a lot of those. If you look at this here, this is mainly in Ontario here for influenza, for COVID-19, H5N1 here. You look at it, and then when we take the first derivative as well, by the first derivative is the rate of increase of searches. And then the second derivative will tell you whether it's concave downward or convex, convex upward or concave downward. And with this, you're able to know whether cases are slowing down or picking up. And what we realized was that both the Google Trends, the first derivative, which is the rate of searching, and then the second derivative, which tells you the convexity, either convex or concave downward, is correlated with the number of cases for the different diseases. I'm just showing the case here of influenza, COVID-19, and H5N1. But all of these, we have shown this for all the other diseases. We did look at different social data and prove that there was correlation. With Google News, which is news reported within local communities and Google gather all this news. This here is COVID-19. We show that there's correlation here between the Google News and even H5N1 and Google News. So we could use Google News to be able to, as one of the variable or the features in training our model. And another data that we use is the number of posts on Reddit, where if you look at here, this is H5N1, and you show here there's correlation between what people post on Reddit, given the keyword that we post in, and the number of cases. Another one is the post on Facebook. Again, as you see here, there's a correlation between the post on Facebook and the number of cases. Same with wiki trends, a correlation here to a certain level between wiki trends, number of time people are reading a particular wiki page about particular keywords that we send in, and the number of cases. Then the air quality, it could be, again, I'm just showing here the ozone, sulfur dioxide, nitrogen dioxide, carbon monoxide, UV index. There's correlation between these and particular diseases, could be COVID-19, influenza, H5N1. Again, the temperature in the environment, just showing here, temperature has a correlation to a certain level with H5N1 and other diseases. I'm just showing an example of certain disease here to showcase why we pick particular data. With GDEL, which is a global database of events, languages, and tone, it takes into account the news pages, TV news, the blogs, social media. We're able to show that there's a correlation between all of those posts for particular keywords. One great thing about GDEL is that even the signal of other things, when people are talking about things, you're able to pick this up very easy. If there's a protest, anything that's happening around the world in 100 different languages or more, GDEL is able to pick that up, and you can pick that up by just querying GDEL in real time. And we showed that when we used our particular keyword pertaining to diseases, we're able to see a correlation between GDEL and all of those. With this now, we build a network either for South Africa, for African countries, or even within here in Canada. You're able to build a network that you give different weights between the different neighboring countries or the different provinces, particular weight based on their interaction. And once you build this model, you have a framework this way that take into account the data that you have, then fit it into the graph that you have created by giving different weight based on the interaction. And then all of these are fed into a concatenated network of deep learning model. Here we have the CNN convoluted to graphical convolutional network, and then we link that to a gated recurrent neural network with unit. Some people will link it to long and short-term, a recurrent neural network with long and short-term memory, but we link that to a gated recurrent neural network with gated recurrent unit. And then you have layers that are able to predict several days ahead of time. With our model, like I mentioned earlier on, we're able to predict 58 days ahead of time. Once we get the features and then train them, convert that to a tensor, train the data set that we have, and then focus that ahead of time, T days ahead of time. At the moment, our T is 58 days ahead of time. Once we compare this to various models, we realize that the model that we have that is a combination of CNN, GCN, and GRU perform much more better than other combination of deep learning neural network, be it for Canada, the countries in the global south that we're working in. And so we decided to use that for prediction. And I'm just showing here the prediction 56 days ahead of time. Currently, at the moment, we can predict 58 days actually accurately. At this point, 56 days ahead of time, you realize that we predict effectively, be it COVID-19, influenza, within provinces in Canada or within countries. It's the same with COVID-19, same with H5N1 across the various countries that we're working in. We're able to predict all those cases effectively. As I present all of these, I had said I was going to take time to present the work that we have been doing with the International Development Research Center, where we are looking at the weak signals that nobody's looking at that may emerge in 5 to 15 years. We use a combination of 3 different approaches. We use expert opinions, where we bring experts from the global south. We use bibliometric analysis, and we use test mining. I will not present the detail of that result. You may find the detail published on our website, but I will just present some of the weak signals that we have identified using these 3 different methods. These are the emerging signals that are anticipated to influence the trajectory of digital One Health in the coming years, in 5 to 15 years. One of those is limited infrastructure, which is a major issue within the Global South. The other one is low internet penetration, where you may not have internet in certain communities like the ones we work in. Unequal access to digital technology, and at the same time, digital literacy from a pointed that way. And in the rise of artificial intelligence, again, I say it strongly that artificial intelligence will become a public good like water that we drink, and we need to use it all the time. Telemedicine platforms, the integration of wearable devices. You find people that will not check their mental health, paying attention to their mental health or whatnot. So this is going to play within the Global South. People talk about this all the time. People that have never visited a therapist, but they are not able to just be inclusive and watch the wearable devices, care about their mental health, and the application of digital technologies for monitoring environmental health factors. So these are some of the weak signals that we identify that will influence the trajectory of digital health in 5 to 15 years within the Global South, using a combination of experts. We had around 100 experts and bibliometric analysis. I want to thank the team at AIMS Lab for the work that they did to get this through, and my colleague at AI4PEP and the Africa-Canada Artificial Intelligence and Data Innovation Consortium. Throughout these, I've been able to show to you the work that we have done in focusing COVID-19 cases, not just COVID, but other disease using RESTful APIs. I've been able to showcase the solutions from the Global South, and going forward, what we expect to do right now within AI4PEP, given the weak signals that we have identified in 5 to 15 days, would be to move from a point where you have solutions that are dying in the university to a point where we scale that up. Any solution that we have developed in any local communities, we are looking at scaling it up. Somebody asked me the other day, what does scale up mean to you? I was talking to a colleague, and I said strongly, it's not just a matter of scaling up from your lab to your neighborhood or to the country, but ensuring that we take a solution developed in Ghana, take it to Malaysia or the Philippines or India, and we're able to work from there, use local data to train the same, because you don't invent a wheel, and scale it up within those contexts. That's what we are working at now within AI4PEP, of scaling up our solution. First, we're still dealing with ensuring that we avoid this valley of death within universities, moving it from the university lab towards communities. That's where we are at the moment, creating impact, and then getting the government to buy into it and fund it to be scaled throughout the whole country. At the same time, once the government is doing that, as they're already doing it in Ethiopia, in South Africa, and other countries, we'll now be moving towards having the learning from South Africa, Ethiopia, or Brazil, or the Philippines to scale in another country, Philippines, Brazil, and vice versa. So that's where we'll be going to. Please, you could check the lab work here, take the work on AI4PEP and the Africa-Canada Artificial Intelligence here. We're looking forward to collaboration for those who are keen on the work that we're doing. Thank you so much, Ms. Bukatus.
Amazing. Thank you very much, Dr. Kong. What an amazing collection of projects and lots of ideas popping through my head, but also lots of questions in the chat. So if we'll take a few minutes just to go to the questions, and I'll just remind the audience, if you have questions, please type them into the Q&A function on the webinar. So one question that's come up in your research, do you also use federated learning techniques, especially considering the privacy and sensitivity of health data? And if not, do you think federated learning could be relevant in your context?
Thank you so much, Professor Rosella. At the moment, within the African countries, because we need agreement with the various countries, we are planning a workshop where we train government officials in this country about the importance of what federated learning is, the importance of using it to be able to have data use data from in one country, different countries, without necessarily respecting the privacy of those data. So at the moment, we are not using it, but that's something we are moving towards using. We have a workshop coming up We just recently wrote a paper on this actually about the situation in Canada because of the conversation we have been having with different countries, with our colleagues in Brazil and Africa, on how we can be able to use those data without necessarily having access to those data. So that's something we're looking into.
And the main reason you're looking into it is to help with the data sharing and privacy. Is that the main benefit?
Yeah, the main thing is the privacy. We have privacy law where you want people to keep their data. At the same time, you don't want them to be left out of the AI revolution because you want their data to be included.
Yeah.
We can fight strongly where people should own their data. The corporate world will move on with the AI solutions. If AI become a common good that everybody is using, it means that we will have to use it at some point. If your data is not represented, then you have to use something that does not represent you. We feel that as we are breaking silos around the world in trade, in different issues, again, in trade, I don't know whether we are breaking silos or isolating, but as we are doing that, federated learning become the key where you own your data. Nobody's going to take it, but you are served. A solution is being created that will serve you. So that's the way we're looking at that.
Yeah, that's fantastic. Okay, I'm going to ask you a question about the mosquito models you were presenting earlier. This is a question from Roland. So concerning the mosquitoes from Ghana, was the AI trained for multiple species? And is it malaria or dengue vectors only?
Thank you. No, the AI model was trained to recognize different mosquitoes, all the different type of mosquitoes. Our team at KNUST, I was not involved in collection, collected the different mosquitoes across Ghana in the lab, and then trained based on their wing beats.
Wow, that's great. Okay, I'm going to move to another piece, and this is more around some of the pieces you were talking about earlier. And again, this is a question from the chat on the emotional dimension of AI. So, this idea of having an emotional dimension built into the AI is very compelling to Rose, who's asking the question. But it does raise important ethical questions. So if you have an emotionally responsible AI, that potentially causes harm, who bears the responsibility? Is it, let's say, a clinician or a public health, someone working in public health who's using and trusted the system? Or is it the developer who coded the AI? Where do you sit on this? How have you been thinking about this ethically?
Thank you so much, Ross. So I think that's a regulation issue, and I think we really need to shape who create the AI and for whom. And that's a conversation that a lot of people are looking into. On my part, lately, I've been looking at AI as a common good and thinking of water. Nestle can create a bottle of water, but Nestle, the IP address would not be on the water itself because Nestle doesn't own the water, it owns the bottle that the water is being held into. If the data is coming from the public, even when you already build an AI model, the public, when you use ChatGPT, you use your data, you are contributing to that. So where will the intellectual property, what do you own when you create the AI? That's a question I've been really baffling into. I did meet with a couple of IP lawyers last week to have this conversation on writing a paper on driving this conversation on what is the intellectual property on when it comes to AI? If AI become a public good, and that's the same thing with the emotional piece then, because what part of that do you take ownership? At this moment, I myself am battling with that because I'm asking the same question. I'm still at the point of intellectual property and moving towards that. If you have an answer, and again, I know a lot of lawyers or experts have been looking into these. I did bring in a lot of lawyers within Canada and the Global South last week to have this conversation. But at the moment, we are still just having conversation in that direction. And if you have ideas, we would love to hear what you think.
That's great. Yeah, I think this is a topic that needs lots of conversation. Okay, this is a question from a student. And so the question is, are there any ways for students to get involved in supporting AI projects in the global south, including those that might have a more biology or health background? So what's your message for this student and actually other students who are interested in this work and want to get involved?
I mean, I don't know if you have checked M's lab. Within M's lab, every summer or work study program, we have work study program projects that get towards building AI solutions for communities. we always get 5 students, and they always end up with this team creating a solution. You just check our lab or look at some of the publications that the students have published. Throughout every summer or within the fall term, we get this work study program student. Please do visit us, send us an email. We're looking for students. Currently, right now, we're about to take in the students for this summer. If you haven't applied to the work study program.
That's fantastic. And then maybe last question I'll ask. Often in, this idea of community-oriented AI and making sure that we are going back to the community and this is for community, sometimes that can feel intimidating to people that are trained in math like you or AI or data sciences, because it's not something that maybe was in their training. What's your advice to people in terms of how they can open up their work and engage more with communities, especially if they're just thinking about how to do that in their work?
Thank you. So it could be intimidating, but once you get into communities, you realize that you get a lot of questions to answer. You become passionate because you're seeing issues within your communities. You open your lab to a lot of different questions. What I've realized is I meet with communities here in Toronto every 2 weeks. General Finch, the Black Creek Community Health Center is one of them that I met with them. They have community ambassadors, and they come and discuss what is happening. I am a tool to solve one of the issues. And when they present a problem, I realized at some point that even though the method, I was thinking I was going to apply. Then when I'm trying to apply to solve an issue, I realized there's no method. And then I tend to develop method to solve that issue. So at the end, I develop the method and I'm able to apply them. So instead of just thinking that if you go to a community, you just be applying, no. You create new methods because there are new challenges. Because over the years, scientists have sat in the universities, think of a problem and said, this is a problem that communities are facing and this is their solution. They designed that. Then nobody ever adopted it. And it doesn't change anything within the communities. But when you spend time, you learn from the communities and you're part of the tool, you realize that it enriches your research. You are passionate about it. You create tools that people will use. And then you end up having so many problems that you're passionate about it, not even thinking that, oh, I'm just doing it for publication or whatever, because you want to solve an issue within your community. So my advice to you is to build the relationships. It takes time to build a relationship because people have gone to communities just to get their grants, and then the communities never have them. That's what happened. Give me a letter, give this. Take it from a different dimension. Don't care about whatever, care about solving an issue within your communities. Once you care about an issue within your community, something you're passionate about, you don't care about whether there's money. Keep money aside, only your community. That's when you solve an issue. And that's when you realize that you get more excited. You may be excited about an issue now, but that will take you to a different level.
Yeah, I totally agree. Well, that's a perfect note to end off on. I think we have a final slide to pull up, but I want to thank everyone very much for attending this fascinating talk, especially Dr. Kong for sharing the insights and experiences and so much for us to think about. We have a feedback survey, so if you could take a moment to give us feedback on the session, we would really appreciate it. And I also just want to remind people again that this event is CPD accredited if you need it. And next month will be our final speaker series for the year. We have Dr. Frank Rudzich. We also have our trainee rounds through the summer, which are excellent. I highly recommend you check these exciting projects out from emerging researchers across Canada. So check our website. Thank you again so much for joining. Thank you, Dr. Kong, and wishing everyone a wonderful day.
Thank you, Professor Rosella, for support. Bye.